There are calls today for an inquiry into New South Wales' mental health system after a mother of two died while in care. Miriam Merton passed away in 2014 from a brain injury after falling up to 25 times at the Lismore Base Hospital. Confronting security video shows her stumbling naked through the regional hospital wards. News Limited reports the local health district carried out a full audit, but the state opposition is demanding a full parliamentary inquiry into the incident. Joining me live now is mental health expert Professor Ian Hickey from the University of Sydney's Brain and Mind Research Institute. Professor, thank you for your time this morning.
Good morning.
First of all, I'd like to get your reaction to this story on the front page of the Daily Telegraph today. How common is the use of seclusion rooms in mental health treatment? Because this is apparently what Miss Merton was subjected to before her death.
Sadly, these facilities are still common throughout our mental health system and throughout our emergency departments in New South Wales for dealing with acute behavioural problems in people with mental illness. Now, it's important to say, as far back as 2005, we decided nationally to cease this practice. The National Commission that I'm a member of in 2012 prioritised this for the states to take action to replace this way of managing behavioural disturbance with more appropriate facilities, better staff training and better respect for the dignity of those who are suffering these particular conditions.
And do you support the need for the calls for an inquiry into mental health treatment in New South Wales? And if so, what does this need? What scope should this have?
I do not think we need another parliamentary inquiry. We've had hundreds in Australia. We need action by the Premier on these recommendations that were made state by state. There are clear solutions here. What this is 19th century practice in the 21st century. We wouldn't see it in other intensive cares, in heart units, in children's hospitals, but we still see it in mental health. It requires investment in the facilities, the staff and the staff training, so this is not standard practice. It should have ceased by this point.
Professor, how prevalent is the use of these seclusion rooms within the New South Wales health system? Why does it continue despite the recommendations from the body of which you're a member?
Because every time we build a hospital, every time we build an emergency department in New South Wales, we continue to build them under the mistaken belief that this is therapeutic or helpful or safe. All the evidence is the opposite, and this kind of tragedy, which we now see from the video footage today, has occurred over a long period. So we should have moved away. We should have stopped using this approach in the 20th century. Now, well into the 21st century, we have had it continued. We just don't make the investments in the alternatives. The physical infrastructure, the staff numbers, the staff training to manage these acute situations in an appropriate and safe way.
So is it simply a matter of greater staff numbers that are required within the health system, or do health professionals need updating on the way in which it is right to treat mental health patients in the 21st century?
All three. We need better infrastructure. You have to build physical facilities, not small cell-like rooms. You have to train the staff to move away from this custodial approach. We are not jails, we are hospitals. And thirdly, you have to have the number of staff available. So the most effective issues are so-called one-to-one contact between people in this situation. This tragedy should never have occurred. This woman should not have been left to wander through these wards with repeated injuries, not commented on, not responded to by the staff, and somehow accepted as being normal practice. There is nothing normal about this approach to a person with an acute medical problem. Just like a heart attack, just like intensive care, just like elsewhere, leaving people in a life-threatening situation without appropriate care is not acceptable in the 21st century.
Professor Hickey, if I can switch topics to a study one of your colleagues put out earlier in the week, a warning about using mental health apps. Now, they say that whilst they wanted to initially get a list of the best apps, in doing the study they found concerns and didn't want to recommend any of them. One of the chief concerns was you simply download this, you don't seek professional help, and also they have with these sort of guarantees, you know, you're going to feel better in a month after this app, and if you don't, you feel like a failure. What's your take on these apps?
A lot of work's already been done in this area. I was quite surprised to see this report from my own university, because I've been part of a process now for the last decade of professional and user ratings of mental health apps. There's a body of evidence worldwide of actually their usefulness, both from a traditional medical evaluation point of view and psychological evaluation, as well as which ones people find useful in the field. We're actually undergoing the Uberisation of mental health. It will no longer be controlled by professionals and traditional researchers. So in other areas, in the sort of choice-like way, in the consumer ratings of trips and hotels, what we'll see is the equivalent of the rating by the users as to how good they are, and then rating of the quality. So I'm associated myself with the development of instruments and processes for exactly that. In Australia, we've got actually international leadership in this, and the Productivity Commission's actually recommended less regulation. We need to make these things actually more available and not seek to regulate something that actually has the potential to do a great deal of good.
You mentioned the Uberisation. That means presumably is there going to be concerns from, would you call it, self-interested professionals, hoping that they're not cut out of the loop on this?
Yeah, the professionals are the old taxi driver industry, licensed, regulated, everyone's unhappy with them. They're hard to get them, you can't get them when you need them, they cost a lot of money and they don't meet your needs. The great thing about the digital revolution is a lot of these things work, they encourage people to come forward, they get mental health care, they do what they want, and interestingly, as people use those, more people then get the clinical care that they actually need. So actually what is happening here is a tremendous community demand, and in Australia we have some of the leading areas, and our Prime Minister has specifically invested in this area in processes I'm personally associated with, to actually bring this technology to Australia. What we're going to need is to grow up and use it and not have the professions behave like the taxi drivers.
Just finally, the concerns though, things to look out for. Presumably it only takes one case where an app's really sent someone down the wrong direction for people to start saying, is this the right approach?
Well, the apps themselves are both, it's pretty easy to go onto an app to find out that it's produced by a university, is it produced by a credible source, is it backed up by sensible systems. Apps are just the start. In fact, apps are a little bit 20th century now. There's whole digital health systems growing up around particularly mental health because there's such a gap between community need and the potential to reach people in regional and rural Australia, those who don't want to see a doctor or a psychologist. So we're already seeing a great deal of maturity developing in this area. We have to be careful that it's not misused or people get lost. But as I said earlier, most people who start down this track actually end up using more clinical care. Actually, those who avoid care are those who don't in the first instance want to talk to a doctor or a psychologist, but they will start to talk to an app and change their drinking behaviour, change their sleep-wake cycle, start to actually deal with their own suicidal behaviour. Really interesting opportunities for the first time through digital technologies.
Professor Ian Hickey from the University of Sydney's Brain and Mind Research Institute, thanks for your time today.
Thank you.